says Karen Riddell's on the phone.
All right, good evening, everybody. Welcome to the March 4th, 2021 open board meeting. We will call the meeting to order. Next up, declarations of conflict of interest. Seeing none, thank you. Can I get a motion to approve the previous minutes? I have Paul LaChance, seconded by Lori Frieden. And questions or comments with regard to those minutes? Seeing none, all in favor? All right, perfect, thank you. So I do have a captive audience right now, and I just want to make three very short announcements. The first announcement is we are recruiting for our board committees or standing committees. These are not board positions, these are standing committee positions. We have the quality of care, as well as the finance, audit, and resource committee. So please, if you know anybody that is ready to make a great commitment to the community, please have them look on our website. The posting will go live on March the 6th, and you have until March 22nd to apply. So again, that will be in the Windsor Star on March the 6th. And you will have until the 22nd of March to get those resumes in. So please apply. Next up, I want to just take 2 minutes to say thank you to a couple of our community partners. So the first one up is the BANA. So that's the Bulimia Anorexia Nervosa Association. So currently they are doing the Be Kind to Yourself campaign. Basically saying, you know, it's been a tough year, be kind to yourself. And so that goes into one of our second community member that I want to shout out. So one way to be kind to yourself is by joining the, it's the one, what the heck is it called? The I Move campaign for the United Way. So, Be Kind to Yourself is trying to get you moving, and it's to support, gosh, too many notes here, I apologize. They are supporting children and youth mental health in Windsor, Essex County. Sorry, that's the I Move. So just sign up. The Windsor Regional Hospital has a team, but that's it for me. So please say thanks to our community partners. They do a great job, and they really are a big part of our team at Windsor Regional Hospital. So thank you. I'm going to try and wear shirts from our community members for the foreseeable future. All of our community partners need a little extra love these days during pandemic. It's tough to raise money. So please visit their websites. And so with that, I will move over to the report of the President and CEO, David Mouche.
Thank you, Mr. Chair, and welcome everybody to the March 4th board meeting. I'm going to pop up a PowerPoint that I'm going to take everybody through, just kind of update where we sit right now. 1 second, let me screen share. Okay, we all good? So what you're seeing on the screen now is what we've seen in the hospital is in effect a plateauing of our COVID positive patients who are currently admitted in the hospital. If you recall, back in the first wave, our highest amount of COVID positive patients occurred in the middle of May, and we had approximately the highest amount was 27. And then when we went into the second wave, that number more than tripled. And what we've seen, though, is it, of course, dropping after the holidays, but at a plateau level now with respect to our numbers. So, for instance, right now we have 28 patients, inpatients, COVID positive. And what I'm trying to show in this screen is that some people think, oh, it's the same 28 people that were there 3 weeks ago. And it's no. You can see from this slide deck that the numbers keep evolving over time. And we, on any given day, will have a couple discharges now and will admit to more individuals with COVID positive. So it's still fluid, it's still in the community, it's still happening in the sense that we're still, and I'll show some slides later with respect to the number of positives on a daily basis in our community. Again, hospitalization is always a trailing indicator, is you end up having positive, first of all, you end up having, we see more people getting swabbed. That generally results in more positives. That generally results in more hospitalizations, critical care, and unfortunately, in certain cases, individuals pass away. So this shows a steadying of the in and outs with respect to the COVID new admits. And then the next slide is our assessment center volumes. And as you can see, this starts on the far left November 1st and goes all the way to March 3rd. And you can see the dramatic increase over November into the holidays and then starting to descend around January 18th, January 20th. And in large part, you have to have symptoms to get swabbed, even though there still is individuals that attend our assessment center who are visiting their loved ones in long-term care, retirement home, etc. You have to be symptomatic. So we saw a drop-off as shown here in and around the 12th, 14th of January, and a steady decline. But then you'll see over the last couple weeks, it start to inch up again, and the number of people getting tested is starting to creep up. And hopefully it stays where it's at now. But again, it's just like our hospital inpatients. It almost seems to be a little creep, but a plateauing. Hopefully that's a plateau and we're at it. But the numbers clearly now are far greater than what we had in the first wave with respect to symptomatic being tested, as well as 28 is still higher than we ever had in the first wave. So we're getting used to, quote, like a new normal, which is higher than the first wave for sure. Go to the next slide. What we have seen, though, is this is a subset of the previous numbers. This is age 17 and under that are getting swabbed. So you can tell the increases that I showed, that gradual increase over the last couple of weeks, is due in large part to the pediatric cases, which involve the various school outbreaks and the cohorts coming in pursuant to public health's request to get swabbed. So we're again seeing that number go up over the last couple of weeks. And again, if you go back to November, that same pattern was happening in the middle of November. And then if you recall on the previous slide, that resulted in, or the impact of that was an increase in number of COVID positive patients overall that eventually came in the hospital. I'm not saying that's the direct link between what happened in November heading into the holidays, but you can see it's a similar pattern with respect to what we're seeing now. as what we saw in November. The good thing is overall, this is from WeChoose website. The top is the cases by date, the number of positives in our Windsor Essex region. Again, as stated, it seems to be a leveling off. So plateauing, you could say, and that's been happening all the way through February, through late January into February. And then the hospitalization, again, from a Windsor Essex perspective, so including ourselves, Hotel Dieu, and Erie Shores, you can see the numbers dropping, but then again, rising a little bit and plateauing for the last couple of weeks, 3 weeks, and staying steady. But again, it's not the same people, meaning it flips. People get resolved and people are replaced. The important numbers to track is with respect to the effective reproduction, or what they call the R value, is you want your R value below 1. Just over the last couple of weeks in Windsor Essex, we've been able to get that R value to now below 1 into the 0.7 range. From my understanding is when the variants are in a community, which they now are here in Windsor Essex, they're across the province, you want to get that R value as low as possible, because again, if you don't have reproduction of the virus, if you can slow that down, then that slows the mutations, slows the variants, and takes, quote, a lot of wind out of the sails of the variants. And the way you reduce your reproduction number, of course, is through public health measures, et cetera. And then you'll see the percentage of positives as well. Again, that plateauing, that steadying rate, sitting around 2.5% now, and kind of has been that way since the end of January. So you might take a step back and say, wow, these numbers look great. We're on the right track. We're in the right spot. Dr. Ahmed made it clear today, because I think he was asked a lot about, well, based upon this, are we going to, orange? And his answer, in effect, was, we're not quite there yet, even though our numbers as compared to November look a lot better. In December, we're still at a pretty high rate, and we're not where we need to be in order to get to those lower levels of be it orange, et cetera, as we move forward. So we'll see where that goes, but it almost seems we got to see another week or so of this to make it seem like a pattern as we go further. Then today, unfortunately, what we saw is, this is from the Toronto Star, but it's a report that was done. And you'll see what it does is it looks at the projections, and what this individual, Scarson Corporation, indicates is that they're of the opinion there should be a possible another lockdown in order to avoid the worst case scenario. And they're suggesting one takes place at the end of March, it takes place now to avoid this, or soon to avoid this worst case scenario. You can see by the red line of the impact of the variants. And then the best case is if there is further, quote, lockdowns, what those numbers look like versus a base case. So we're really in an uncertain time with respect to the impact of the variants, what the variants could do with respect to the spread, the community spread, and then eventually the impact that might have on hospitalizations. And as we said, critical care and then the outcomes with respect to critical care. So that's a concern as we move forward. The positive news again is the fact that right now in our hospital, out of the 28 cases, typically back in wave 1 and wave 2, at least 30% of our cases of COVID positive patients were long-term care retirement home residents. That number moved up and down a bit, but that was kind of the core amount. Today, we only have 2 long-term care residents who are actively COVID positive out of the 28. So clearly less than 10%. So what does that hopefully show us is a handful of things. Is number one, a lot of the work being done in long-term care retirement homes are working, the partnerships are working. That'd be one thing to draw out of it. 2, the vaccinations. They've taken effect with respect to Moderna, holding with the residents, as well as all the staff who wanted to be vaccinated in retirement homes and long-term care homes have already received their 2 doses of the vaccine and are well past the time period for the highest amount of immunity to take effect for them, or protection to take effect for them. So hopefully those 2 factors are causing that impact. And it's not just here in Windsor, Essex, but it's being seen across the province as very positive from that point of view. The other item out of the 28 is right now 10 of them are age 80 or older who are inpatients at the hospital. Again, that number sits around there. A lot of people think, well, COVID only impacts those in that age group, and the answer is no, of course. But hopefully with some of the work that's being done with respect to the 80 plus starting to get vaccinated, as well as we're going to be starting the vaccination of those receiving home care through home and community services. We're going to be starting that as a region. That will hopefully help with the overall numbers, clearly, of those testing positive for COVID, as well as the impact of hospitalizations as we move forward. So the big question we're facing is, what is the impact of the variants? And a lot of individuals might say, again, the numbers look great. Why are we so concerned, or why are we so on edge, or are we just being overly concerned? And it's no, because we've seen other jurisdictions with the variant and the impact that has on other jurisdictions. So for instance, look at Brazil. Brazil before the holidays thought they had created herd immunity because they had 70% of their population test positive. They opened everything back up. Things were fine. Very little COVID being spread. Next thing you know, there's a Brazilian variant that, again, reinfects people who were previously positive with the variant to the point of hospitalization and death. And that Brazilian variant, on a very small degree, is being found in North America. And I think there's been one case identified in Ontario. So that's what makes everyone very concerned, is the unknowns about these variants, be it Brazilian, be it South African, be it the UK variant, and the impact they might have. And that results in these types of projections, which identify some big concerns as the variants take hold and become the greatest number of percentage of creating the positive percentage rate and their ability to replicate and increase that replication rate and pretty much go through a community very quickly and result in the hospitalizations and those negative outcomes. So everyone's been very concerned about the next few weeks, is the impact of those next few weeks, what it's going to look like, and having everyone continue with the public health measures is do not relax or let your foot off the brake, stop pumping the brake, is we really have to, and try to do everything we can to adhere to those public health measures. So that's my overall report, Mr. Chair, unless there's questions.
All right, folks, questions for David? Sorry, just going through everybody here. No, looks good, David. I think as much as I think everybody's probably tired of talking about COVID at this point, but this is good information. So remember, community, just be smart. Please continue to do your part and keep people out of the ER. But if you need to go to the ER, please make sure you go.
Yeah, maybe I could add one thing. So a lot of questions regarding how are we doing with respect to our return to surgical services. And I don't know, Dr. Saad, if you wanted to add overall how we're doing. Sorry, put you on the spot. You there?
Thanks, David.
Oh, yeah.
Yeah, we're actually doing quite well. We have the Olette campus that was back up to 100%, and the Metropolitan campus up to 90%. So we've been doing everything we possibly can to do as many surgeries. These are both elective surgeries. Of course, emergency surgeries and cancer surgeries never stopped during the pandemic. But in anticipation of a potential third wave, we're doing as much as we possibly can to catch up. And I think we've been doing a good job and ramping up to almost 100%. So we'll keep that going as long as possible, and try to do as many cases as we can safely.
Thank you, Dr. Saad, for that information. Oh, Anthony, you're on mute.
This technology, one day, a year, and I'll get it someday. So we have the Schulich report from Dr. Jacobs. That's FYI. So next up, we have the financial presentation and treasurer's report with Penny Allen. Oh, hold on, Penny. We're almost there. We got to get you unmuted.
Can you hear me now?
Yes, perfect. Thank you.
Good. Okay. Well, I'll go through this then. The year-to-date deficit for the hospital operations is $13,980,000. Revenue is $7.6 million favorable to year-to-date, and expenses are $22.9 million unfavorable, with the largest variance in that is with salaries and wages. COVID-19 unfunded expenses date in the amount of $13.2 million, but understand that's because you have to put a report in, and then you have to wait for the government to pay you back, and they don't do it month by month. They do it with maybe 3 months or something like that. So that's why it's you'll get it, but you got to wait, and that's $13.2 million. The deficit after the building, after the net building amortization is $16,153,000. That extra amount is basically what they call amortization and depreciation of buildings, and so that's what makes it look more deficit. It should be noted that the unfunded COVID-19 expenses had been, if it had been funded when the costs were incurred, would have been $3 million, and the hospital margin would have been positive $648,000. So that's the first one. The next one is The next one is about the impact COVID has on the year-to-date financial results. To date, we have received for COVID-19 operating expenses from April to September in the amount of 13 million plus 7 million for earlier pandemic pay. Generally, there's been 2 to 3 months, as I said, a lag in ministry reimbursements. And the decreased patient services revenue are mainly diagnostic revenues, which are 10% about the target to date, and preferred accommodations are about 77% below budget. But that all comes back to COVID as well. And then year-to-date revenue is base and one-time funding is 5.8 million favorable to date, while revenue from our quality-based procedures are lower than budget by 8.5 million due to the reduction in elective surgery cases. One-time funding is higher than the budget by 18.1 million, as this is where we report ministry reimbursements for the expenses. That's the same. It does sound, just a comment, what Dr. Saad said, when those elective surgeries start coming back, we will, that will be helpful, because that's part of the funding that's been missing because we couldn't do it, basically. The next item is the patient services revenue is favorable to year to date, and the month on Windsor Regional Hospital, as Windsor Regional Hospital received 895,000 in uninsured revenue in January from August to October. Drug reimbursements favorable 3.2 million. However, these are offset by the drug expenses that they have to incur. So it's pretty offsetting. It always has been. Other revenues are slightly unfavorable to date, as the reduction in services have affected the retail food and parking revenues. These were 185,000 below target in the month of January. And then moving over, I have the quality-based procedures. The slideshow shows year-to-year comparison of volumes for a number of quality-based procedures using coded data available to December. For these groupings, the combined there is a combined 12,477 case reductions, representing funding that has not been earned as of 15.5 million. And that a lot of is the elective surgeries. And while we didn't really earn this revenue, the fact is the hospital would not have incurred the costs normally associated with the expenses to do these procedures. Other expenses, salaries and wages are unfavorable to 12.8 million year to date, 2 million unfavorable in the month of January, and includes the following variances: COVID-19 screening of staff, patients, visitors, and staffing of the assessment center, $774,000. COVID sick and isolation pay, $292,000 in the month. This is all in the month of January. And higher inpatient medicine and critical care staffing due to a surge in the COVID-19 patients, which is $606,000. Net patient services revenue to med fees is $896,000 unfavorable. As of the end of January, there's 418,000 unfunded COVID-19 physician payments. Med surge supplies are unfavorable year to date by 206 million. Savings in the savings in the perio-operative program at Met Campus is 986,000 to date and 1.9 million at OLAD. Increment spending on PPE, which will be a lot for COVID, is 13.4 million. All right, sick and isolation pay to date. This clearly shows this slide the impact of the 2 waves on our staff sick and isolation payments. You can see the uptick in December and January related to the second wave. Sick pay due to COVID-19 was $229,000 in the month of January, which is the highest since the pandemic began. Sick pay to date is $842,000. isolation pay is $795,000. That's to date. The 229 was just the month of January, which was a big one though. Okay, next one, drugs. While drugs are at 5.3 million unfavorable to date, most of this variance has been revenue recoveries either from retail pharmacies or from the Ministry of Health in chemotherapy and renal programs. Other supplies, 132,000 unfavorable overall and 741,000 unfavorable in the month of January. The major deficits are summarized on the slide, which you can read. Yeah. And so that's that. And the next one is patient access. Both Met and OLED acute care over the expected length of stay, and a contributing factor are long lengths of stay required for the COVID-19 patients. Patient volumes, as shared previously, since we are not operating at normal levels of programs and services, all metrics are below target because it's mainly COVID patients. Patient volumes, the graph compares the year-over-year volumes in January and the difference. All are trailing behind the target except for community visits, as this includes 92,582 COVID assessment center visits. That's a lot, actually. So I can see that. Wow. And then 6 and overtime and the full-time employees. Sick is trending worse than in the previous month, as is overtime at the OLET campus. 9% of the total paid 6 hours to date are due to COVID-19. Benchmarks show that if these were not included, total FTEs for Met and OLET combined are 1.3 over budget. So yeah, it's been a little bit rough in January and actually year to date, as everybody knows. So that's my presentation and report. So does anybody
have any? Yeah, does anybody have any questions for Penny? Oh, thanks for the thorough report, Penny.
Okay, thank you. And then I can move that the financial report with the January 31st, 2021 results presented at the March 4th, 2021 meeting be accepted.
All right, can I get a seconder? Dr. Lori Freeman. Perfect, thank you. Questions, comments? Seeing none, all in favor? Very good, thank you. Sorry, I was getting a little ahead of myself. I'm trying to get people out of here for some reason, and I skipped right over Dr. Jacobs. So Dr. Jacobs, if you want to give your Schulich report, so I do apologize.
No problem. Can you hear me okay?
Perfect.
Perfect. So I just have a couple of brief updates. One is some good news. Our medical students who wrote their Medical College of Canada board exams this spring had a 100% pass rate. Which is, can't do better than that. So they use their time to study wisely is probably the moral of that story. So that was pretty good news there for them. Second thing to sort of maybe just bring attention to, so Western University has announced already that they have plans for full in-person learning in the fall. I mean, that's the hope. Again, because our students have that nebulous relationship where their Western students housed at the University of Windsor will navigate that as we go. But the hope is to get back to some a bit more in-person sessions once the new year starts in next September. I do think that there will likely be a few things that which we'll keep from learning from this. Obviously, this media allows for some, different ways of bringing groups together, which I think we'll hold on to at least a few parts of it. But we're hoping to get back to some normal business in September, touch wood. Last thing is actually just another sort of marker of how much appreciation I have as a school representative here. In the Ottawa Citizen yesterday, there was a very large, almost scathing report of how medical students in Ottawa have not been the recipients of any vaccines, even the ones that are working on wards where COVID patients are being cared for. And one thing that I noticed very early here is, as our students have been involved in providing patient care, they were also being tapped on shoulders to receive benefits of things like vaccination. And it really does speak to the amazing relationship that we as a school have here with this hospital as a partner. And I really do want to express my sincere thanks. That's everything for me. Thank you very much.
Thanks, Dr. Jacobs. Anybody have a questions or comments for Dr. Jacobs? Seeing none, wonderful. Thanks, Dr. Jacobs. So we have the correspondence media report there for your information only.
Anthony?
Oh, sorry, yeah.
I have to make a motion under the consent agenda.
Oh, yes.
So that's all it is. So that the report from the February 22nd, 2021 Financial Audit and Resources Committee meeting be accepted. I move that.
Thanks. I got seconded by Arvind. Sorry, questions or comments for those? Seeing none, all in favor? Thank you.
Thank you.
I should have had my coffee this morning. I clearly did not have enough. Cynthia, you had a question?
Oh,
I do.
Go ahead.
Mute. Okay, I just wanted to extend to Dr. Jacobs and the med students, congratulations on your 100%. That's something to be very proud of.
Thank you for that. So correspondence, no other motions. Date of our next meeting is April 1st, 2021. And I do have two other, I got emailed during our meeting, just a couple other things to say. Don't forget the 50-50 draw for Windsor Regional Hospital is also ongoing. These are fantastic. I think our last winner won $106,000, but even better, Windsor Regional Hospital ended up with $106,000 approximately as well. Mark Fathers is graciously supporting us with his background now, so we appreciate that. Next up, these four young students have been patiently waiting to hear their names called. So I just want to send a special thank you to our group of Odette School of Business MBA students that are with us currently. And sorry, I've got to go to the right. It's Christian, Taylor, Miranda, and Melissa. Sorry, I'm not going to try and pronounce your last names unless you want me to butcher them. But thanks for all your hard work while you're with Windsor Regional Hospital. Enjoy your time. And if you have any comments, questions, please reach out to Giselle. All right. Again, thanks, everybody. Can I get a motion to adjourn? That's Patty France, seconded by Pam. I assume nobody has any questions or comments with regard to that. All in favor? Perfect. Thank you. So I was going to say it's 5:40 right now. So board members, if we can reconvene at 6 p.m., that would be perfect.